Thank you. Good afternoon, everyone. I feel a little bit like an alien up here, not because I'm a New Yorker and a Giant fan, but because I represent a network of primary care physicians, and I feel like today I've seen so much great science, but now we have to try and bring that more into the primary care arena. Dr. Snyderman talked today a little bit about what can you do to change healthcare. About 10 years ago, several physicians sat in a kitchen in Boca Raton, Florida, and said, what can we do to make it better? We're seeing more and more patients, we're making less and less money, and our patients are not getting the prevention that they need, and they're not staying well like they should. I'll pose that question to you. What would you do if you could change the healthcare experience to make it patient-centered and to make it what patients want? Well, we've done some consumer research, and I can tell you what patients want. They want personalized healthcare. They want their doctor to make decisions on their behalf. They want them to take the time to listen, and they want them to know about them, their families, their medical history, and their risk factors. They want to be experts, and they want them to really know what's out there in science so that they can have the cutting-edge science and assist them with managing conditions while they keep them well. They want them to care and understand, and they want to get in when they want, and they want to have the convenience of knowing that they can make a phone call and get their questions answered. I think Walter Cronkite said it best: America's healthcare system today is neither healthy, caring, nor a system. These physicians 10 years ago sat down and said, what can we do to make this better? And they came up with the personalized care approach, emphasizing wellness and prevention, not just sick care. Work on superior customer service and convenience for patients. My ultimate goal as I work at MDVIP, and I'll tell you a little more about what I do, but my ultimate goal is to be able to say, join MDVIP and live 10 years longer and better. So what is the difference? In traditional primary care, as most of you know, because you go to your doctor's office, you sit in the waiting room, and they have over 2,000 patients. You get about 8 minutes a visit, and you really don't feel like they can prevent your illness. They're too busy on the symptom of the day. MDVIP physicians try and help their patients stay healthy. They cap their practices at 600 patients. This is how you can have half an hour follow-up visits, an hour and a half physicals, and no waiting rooms. They have a more holistic approach. They talk to all the specialists. They coordinate your care, and if you call and say, I have a problem, you're in that day, so same-day appointments. It works by patients paying a membership fee. So as Dr. Snyderman talked about the reimbursement, physicians can take the time because they're getting this membership fee, and so they can continue to cover their overhead while they take better care of their patients. It's really a patient-centered medical home model, if you know about that, and that's one of the buzzwords in the government today. Proactively working to keep the patient healthy, coordinating their care, except in most practices, a patient-centered medical home has a team of people. In an MDVIP practice, it's a physician and probably one back office nurse. So how do we do this? We're a network of over 500 physicians across the country. About 70% internal medicine, family practice and subspecialists make up the rest. We have over 180,000 patients our physicians are caring for. We are a wholly owned subsidiary of P&G and the fastest growing Procter & Gamble brand. And as I listened to the entrepreneurs, I really thought about it because the people who started our company are true entrepreneurs, and after they sold to P&G, a lot of the original architects of the company are now moving on to their next steps because I think it really is an addiction. So what do you get for a membership fee? It's not about the physician's phone number and the access, all those are really side effects of what you get. You get a wellness program. You pay for a list of non-covered services that really delve into cardiac prevention, diabetes prevention, hearing, vision, emotional health, sexual health, sleep disorders, I can keep going. And you also get a wellness plan and wellness coaching with your physician. So you sit down for an hour and a half for a physical exam, and you make a plan for the year. What are you going to do? Whether it's because you need to lose weight, you need to lower your cholesterol, or you're really concerned because there's cancer in your family and you want to make sure you don't get it. We also continue to identify new innovations, and I think that's where a lot of you can help us as I'm talking about what we are going to need for the future. MDVIP corporate headquarters works with Procter & Gamble, and we work to look out there for new innovations that we can incorporate into the program. How do we personalize it today? I can give you just a few examples. One is we do genomics in some of our practices. We partnered with Navigenics several years ago, and so our physicians do offer genetic testing. It's a piece of the puzzle. You know your family history. You can use it as if you have an elevated cholesterol, but your family has no history of it, and you're really concerned should you be aggressive in treating. You do genetic testing, and your genetic risk is very low. You can probably work on diet and exercise. But if your genetic history says you are at increased risk, you'll want to be much more aggressive. We've worked with Tethys in looking at predicting diabetes. And one of the recent things we put into our wellness program is working with Cleveland Heart Lab and looking at the cardiac MPO. It's a unique marker that tells you if you're at risk for an event in the next 2 years. And when you look at prediction of heart disease, since it is the #1 killer, there's long-term risk. Are you ever going to have an event? Middle-term risk, maybe 10 or 15 years. But most people really want to know also, are they going to have an event in the next 2 years? And I can just give you, I just got this data the other day, so nobody's actually seen this yet. We've done prevention and screening wellness panels on about 100,000 people now using this test, including with a lot of other diagnostic tests. So I'll just walk through this really quickly. But if you just look at the basic LDL or the bad cholesterol, about 30% of our population of those 100,000 people are at high risk because of that. Now, 50% of heart attacks happen in people who have normal cholesterols. So how else can you target these people to really personalize their care and look at if they're at higher risk? With the cardiac MPO, we identified 11% more of those patients who really are at high risk for a heart attack. And then if you look at the ones who are at high risk already, we identified 4% more who are at such high risk, you probably need to take even more action. So our physicians are really trying to work ahead and personalize the care, but also prevent disease. Now, how do we incorporate innovation? We'll do strategic partnerships. As I talked about Navigenics, Tethys, we'll look at companies that we can either incorporate the technology into our wellness program so that all 180,000 consumers will get it, or is it something that's maybe reimbursable or maybe something that wouldn't be appropriate for everybody, and so a physician can just use it on people he thinks, as in the Navigenics. The other piece about incorporating it into the wellness program, our physicians pay for their services, those services out of their pockets. So we couldn't really incorporate full genetic testing because they're not going to spend $1,000 on every patient to do that when that's about what they're getting for the patient for all their care for the year. We do pilot all of this with our physicians, and we have a medical advisory board, a group of physicians that actually govern a lot of what we do. What they've asked me for the next year, can I find them better cancer screening for prevention? Can I find them Alzheimer's screening tests? Because these are the things patients want. They want to know if they're at risk for cancer and what cancers, and they want to know if they're at risk for Alzheimer's. Most patients also are wanting to know more about diet and exercise. As you know, over 60% of the United States is either overweight or obese. And so they want to know more about nutrition and exercise because we didn't learn that much about it in medical school. They need tools for that, whether they be online or other ways to nationally scale. Because as I said, we're a network of 500 physicians across the country. Whatever we do has to work in Boca Raton, Florida, and here in Palo Alto. And wireless technology is something that we're starting to look into. Several companies have come to me saying, oh, I have this great scale, and the patient gets on it, and the weight gets transported to a nurse somewhere, and the nurse will text them or call them. We can actually have that information go straight to our doctor's offices, so that the doctor who knows the patient, who knows they have congestive heart failure, who knows that 1 pound of weight could really be fluid and could send them over the edge, that they can just call that patient back. So we're starting to look into all these types of innovations. What do you get if you do all of this? Well, satisfied patients, we do patient satisfaction surveys, and our patients have satisfaction rates of over 92%. But the more important thing is they renew at the same rates. When you're shelling out money every year for something that's over and above what you get from insurance, you really need to see the value in it. part of the name of MDVIP is value in prevention. We also show strong clinical outcomes. I've done chart review, and we're working on building a data warehouse so I can prove these more. But in the chart review that I have done in about 350 patients, all the clinical outcomes we looked at, diabetes control, cholesterol control, et cetera, all beat the top 10% of HMO, PPO benchmarks and all HEDIS measures. We pick good physicians, but these physicians have the time and the tools to become better physicians and really focus on prevention and wellness. And by the way, we have savings to the system, which I'm going to show you in a second. Oops. So what are our results? We've had a third party look at our hospital discharges over the last 5 years. And what they monitor in 5 mandatory reporting states are hospital discharge rates. And as you can see, we have over 70% reduction in hospitalizations in Medicare patients and close to the same in commercial patients. And I did just get the 2010 data. And so Medicare patients, 79% less. If you are a Medicare patient in the MDVIP network, you have an 80% less chance of being in the hospital than if you are not. What does this do to the system? Saved $120 million in those 5 states and saved Medicare over $300 million in 1 year alone. So now we're working with insurers and the government to say this model really saves money besides preventing illness. Readmission rates are also something that everybody's looking at now. Medicare will not pay if you're readmitted within 30 days with the same diagnosis, and our readmission rates are less than 2%. Our physicians see a patient if they've been discharged from the hospital within a week so that they don't get back in the hospital. So what is the future for MDVIP and what do we need? Because that was part of my charge. Cutting edge science, disease management, cardiac prevention, since this is the biggest killer and this is what most of our patients want to look at. Are there markers for that can detect cardiac disease? Obesity, metabolic syndrome, cancer, and Alzheimer's, like I mentioned before. Mobility, anytime, anywhere, mobile apps that can help them with their risk and risk profiles. Social media, our physicians all have Facebook pages and microsites, trying to instill that sense of community, bringing like-minded patients together. Our doctors also do walk with the doc, bike with the doc, hike with the doc, so that they can get that closer relationship, but that they get their patients healthier and be more proactive. So our future looks rosy, and I'm glad of that. So I have some job security for the next few years. But we've continued to grow. This is our patient growth since the beginning of the company. And our goal is 500,000 patients by 2015. So hopefully somebody in this audience will have some good technology for us to incorporate into our wellness program and roll out to our physicians so we really can help prevent illness and help take care of all the patients in America. And thank you.